All right, Dr. Jones here with Tyler Wellness Center, and I'm with Miss Bice, who just finished her wellness program with us, and we got to address some things with her, mainly diet, some nutrition and lifestyle habits. It was about 4 months that we worked together, and we just got some really good news. We like to run labs in the beginning to get a baseline and see where things are at. And then we like to rerun those labs about 3.5 to 4 months later, just to see the improvements that are made and see if there's anything else that needs to be concentrated on. So I'll let you kind of speak a little bit about what we found and just how you felt.
Okay, well, my blood sugars were out of control. It was uncontrolled diabetes. My A1C was 7.1. It went
7.5.
7.5, wow.
Yeah.
And went down to 5.4, which is normal. And almost off all my diabetic meds, which I'm excited about. And my cholesterol is good, the inflammation is down, I'm feeling amazing. So
Awesome, yeah. And so we also look at a lot of markers, and one of them in particular is an inflammation marker, and it went from above normal down to normal range, and so that is a really good indicator. And then cholesterol is all improved as well.
Yes.
Total cholesterol, LDLs, HDLs, and triglycerides. So really cool to see. Now, just briefly, I know you spoke about other diets or nutrition plans that you had done before. One in particular was very calorie restrictive, called the HCG diet.
Yes.
And just if you could briefly explain the difference and how this one compares.
Okay, the HCG, you were limited to a certain amount of foods and 500 calories per day, and you had to be very strict on that, very
Limited,
very limited, and very hard to follow or stay with. But I did, because I was determined, and in 30 days I lost 30 pounds, which I was really excited about. But here, in 4 months I've lost 60 pounds, and it's just healthy eating. There's nothing I really had to change, just about caffeine and dairy and what else?
gluten, yeah.
And that was
So
it.
really just avoiding the inflammatory foods. There's 5 main foods that we have people get off of in the beginning because they promote inflammation. That's gluten, dairy, soy, fried food, and processed sugary foods. So that is pretty much across the board. Those foods promote inflammation in most people. And so we're here to decrease inflammation. People feel better when you do that naturally, and so that's a great way to do that. But I appreciate you sharing with us, and we're just really happy for your success and how well you're doing, so thank you.